speaking of topics that seem to recur on the program, we have yet another Obamacare-related delay to discuss. First, there was the delay of the Obamacare Medicare cuts until after the election. Then we talked a couple of weeks ago about the delay of Obamacare's employer mandate. And now we have yet another delay when it comes to Obamacare. The out-of-pocket caps are going to be waived until 2015. Now, out-of-pocket caps are one aspect of Obamacare, which basically says there's a maximum that you can make the insured individual pay out of pocket in addition to the cost of the premium in a calendar year. So it might be, I don't know, you've got a $400 a month insurance policy, which adds up to $4,800 for the year. And the policy says that regardless of your copays, your coinsurance, whatever it is, over the course of the year, the maximum out of pocket is, for example, $5,000. That aspect of Obamacare is going to be delayed. This is, of course, bothering a lot of people, understandably. And the reason for the delay is federal officials said that many insurers and employers needed more time to comply because they used separate companies to help administer major medical coverage and drug benefits with separate limits on out-of-pocket costs. I have a lot to say about this. Number one, the reason it's getting delayed is because of the insane, overloaded bureaucracy that already exists within the healthcare system. Number two is that we already know that, as Wendell Potter describes in his book Deadly Spin, that the idea of single payer is not an idea that is completely crazy and foreign to the United States. Back around World War I, the US was actually going in the direction of single payer, and it abandoned it because it was a little too close to the German system. And of course, Germany, one of the enemies of the US in World War I, and it just didn't seem like a good idea. It sounded too German. And that's the direction we have to be going in. This delay, Lewis, every time we say the same thing. Obamacare does some good things, but it further enforces and locks in the private insurance system. Yet another aspect of the system that proves single payer is the way to go. And I just wish I were more optimistic that we were going to get that anytime soon.
Me too. Very unlikely. And it's interesting. One of the things we rarely talk about when it comes to healthcare is the bureaucracy and just how complicated and convoluted many aspects of it are. It's really unfortunate.
It absolutely is. And we're going to keep pushing for single payer. It is the way forward. I just don't know what else to say. I wish I had more confidence we were going to see real progress. Of course, we'll follow the Vermont single payer experiment and how that progresses. We've got a great bonus show coming up today. The bonus show, if you haven't seen or heard the bonus show, you're missing a lot. People are, the reviews are in, Lewis, and the bonus show is, it's a hit. It's a summertime hit. Lewis hosts and produces the bonus show. Today on the bonus show, we'll be talking about a judge deciding to change a baby's name for religious reasons. It's absolute lunacy what's going on. We'll also talk about an interesting campaign stunt going on in Europe. We'll discuss whether these campaign stunts would be seen positively or negatively by American voters. How do you get the bonus show? Very easy. davidpakman.com/membership. But for the next few days, davidpakman.com/NYC gets you a free t-shirt with your yearly membership. Check that out. We'll be back after this.